Good morning. My name is Lee Nimitz, Vice President and Chief of Staff with the Council on Postsecondary Education. On behalf of our President, Dr. Aaron Thompson, we welcome you to this webinar, which is focusing on campus planning in light of COVID-19. We are very happy this morning to welcome Dr. Connie White, Deputy Commissioner of Kentucky's Department of Public Health, the state agency that has been leading Kentucky's efforts to mitigate the impact of the virus and protect the public's health. Dr. White practiced as an OB/GYN physician in Frankfort, Kentucky for over 20 years. She's a key leader in the Department for Public Health, where she oversees all the clinical services provided by the department throughout the state and leads a number of major initiatives focused on child health and welfare and key issues facing Kentucky adults. Dr. White is a native of Campbellsville, Kentucky. She received her BS from Kentucky Wesleyan College and a master's degree in toxicology at UK. She went on to complete her medical school training at UK and her OB/GYN residency at the University of Louisville. She's been with the Department of Public Health since 2012. Dr. White will begin with a briefing on the status of the virus in Kentucky and efforts to hold back the spread. But we've reserved most of the hour for Q&A. Some questions were included with registrations, and we'll get to as many of those as possible. And we also welcome your comments and questions in the YouTube chat. So Dr. White, I'll turn it over to you.
Thank you, Lee. I appreciate it. And thank you so much for this opportunity to be with you today. As an OB/GYN physician, that I have been in the department for 10 years, so feel like that I've got my public health cred with me as well, and have spent the last few months working with the Kentucky Department of Education on their K through 12 document, and I'll show you a screen image of that a little bit later. As we've tried to tackle how do we educate people in the world in the time of COVID-19. So I'm going to try to pull my slides up here, and that usually always works correctly. Let's do this and this. Okay. So we're going to kind of go through a review of the COVID-19, where it came from. I'm going to do that very briefly, and then we're going to look at Kentucky data, and then we're going to get into the question and answer period. And I've been very careful lately to talk to people that I'm not here to educate you. You're very educated individuals, but what I'm trying to do is inform, because educated people with the wrong information can sometimes make wrong decisions. Or uninformed decisions. And so I think as we go through this and you see what's happening in the country, and you see what's happening in our local state, and the work that's done by our local health department, and I've invited our local health department directors in all of your counties to be present today. I'm not going to tell you what to do in your individual university or college, but I am going to give you the public health tools, and then you can work with those folks as you make plans for going forward for this next school year. You know that probably the most important part that people miss, nobody on the planet Earth has ever had this infection. It's very different from anything that any of us that are alive now have seen. It started in China, where there was a town of 11 million people that had to be completely locked down. Then it spread over into Italy, and you saw the disasters that happened in northern Italy in the Lombardy area, where their healthcare system was completely overwhelmed. Then on the East Coast, it spread from Europe, and on the West Coast, it spread from China, with Seattle, Washington, and California having the first cases and the first deaths. And then March the 6th, which will always be etched in my memory and the memory of every other public health person in the state of Kentucky, is when we had our first positive case. We had a state of emergency declared in Kentucky, and President Trump then on the 13th declared a national state of emergency. We were, I think, terrified would be a good word, because we were looking at modeling using data from China and from Italy and other places, where they were predicting that 45,000 to 90,000 Kentuckians would die from this infection. It's a number we can't even comprehend. And looking at 2 to 4 million Americans roughly dying from this infection. So needless to say, It was an all hands on deck situation at the state level, the local level, and at the national level. Now our experience has led from the initial devastation we saw in New York, and you'll see a slide about that a little bit later, and what you're seeing today in Texas and Arizona, Louisiana, California, and then unfortunately Florida has made the news today as having the most active cases of COVID-19 in a single day as any other state in the nation so far during this outbreak. When you look at cases that are reported, that has to do a little bit with when the lab decides to turn in their reports. Do they do it every day? Do they batch them and send them at one time? Any way you slice that, 15,000 cases a day is shocking and difficult to put your head around. But the main thing is we have no vaccine, we have no cure, and we have no effective treatment. So without any of those major things that you see in the medical community, we have our public health tools. These are not fancy and sexy, and they're not a $1 zillion, face transplant or an expensive medication. They're the basic social public health tools that we have used for decades in other outbreaks. Social distancing, you've heard a lot about that. That was probably a new phrase for many of you until about March. Cloth face coverings, temperature checks, personal hygiene, surface hygiene, and then contact tracing. And we're going to talk just real briefly about each of those to be sure everybody I know you understand what it is, but I think once you get the why that it's there, it makes understanding the importance of these things so critical. So social distancing, that's 6 feet apart. This virus spreads through respiratory droplets. It's a very nice way of talking about spit. It comes out of your mouth, it comes out of your nose. When you talk, laugh, sing, cough, sneeze, anytime that you're expressing air out of your body, you're releasing respiratory droplets. And that's where thousands and thousands of viral particles live in those little tiny droplets. Now, it is true that 20 to 40% of people, let me back up. There are 3 types of ways that this is spread. Obviously, if you're sick and those respiratory particles get on someone and gets into their respiratory tract, they're going to become ill. There are the asymptomatic. There are the people that have this virus that never, ever have one single symptom that we know of. They're the asymptomatic people. So these are the 40% here that never have any symptoms, but still their respiratory droplets have thousands of particles of virus in them. And then the third person is the person who becomes infected. Let's say I was infected on Friday and don't start having symptoms until Sunday or Monday. I have spent the last 2 days spreading those droplets with the viral load, even though I did not know I was infected. So that's 2 days before I get sick, I'm infective, or the person who is completely asymptomatic as an infective during that whole 5-day time that they have these infective respiratory droplets. So that's why staying 6 feet apart is so essential. And if you've ever watched any videos, and I'd advise you to go on YouTube and look at some of those, when someone talks, speaks, and laughs, or sneezes, or coughs, they have wonderful video imaging of how far that spreads. And so that's why they have calculated that 6 feet is the distance that you want to be separated from someone so those respiratory droplets don't fall on you. The face coverings, we know that the governor just instituted a mandatory face covering in public order on Friday. We know that, again, go back to those videos on YouTube and you can see the difference between someone coughing, laughing, singing, shouting with a face mask and without a face mask. So that barrier will keep respiratory droplets from me from getting on you. That research is clear, and there is some research that shows if you are wearing a mask, then you can be protected from my respiratory droplets to some degree. It's really important as we're looking and going into school and you're thinking about you're thinking about face coverings, that the surgical mask and the N95s really aren't needed in schools, except for some certain intensive nursing activities where the viral particles can aerosolize, something that makes people gag or cough or something like that. You would want your nursing staff to have a little bit, or your school health staff to have a little bit more protection. But that's why the face mask is so important. It looks pretty flimsy. It looks pretty boring, unless you get on the internet, and there's some very interesting face masks out there. But it is the separation from us getting people more infected, the higher numbers of infectivity, leading to higher numbers of death, and whether or not we can maintain our activity as we have it today in Kentucky as we're trying to reopen our economy. Screening and temperature checks, there's some disagreement about that among some people, but in the public health world, we know that there are asymptomatic people, about up to 40%, but that means 60% of people do have symptoms. So let's focus on the over half of the people that do have symptoms. And one of the earlier symptoms and most common symptoms that people have is fever. So we need to find these people as early as we can so we can isolate them and prevent them from spreading. So to prevent one of your staff or one of your students from entering your school with a temperature of greater than 100.4, that's going to really decrease the potential that that person's going to get into your campus, get into your buildings, and cause a spread of the virus. And then there's good old hand washing and surface hygiene. These viral particles that I was talking about then fall out of the air. If they don't land on someone, they land on surfaces. You touch those surfaces, you touch your mouth and nose and eyes, and you can actually infect yourself. So the frequent hand washing is important, and the sanitizing of high touch surfaces. And I know you've heard a lot about that as well. And contact tracing, that's another phrase like social distancing that people outside of the public health world may not be familiar with. But identifying the people with the communicable disease, isolating that person, and finding anyone around them that could have been a high risk exposure and keeping them away from others is the way that you actually prevent the spread of disease. We are at such a level now that we're talking about mitigating the spread of disease, but to actually eliminate this disease, you have to do serious early identification, isolation, and quarantine. It has worked with communicable diseases over the years. I know some of the universities we've worked with different outbreaks that are listed here. Mumps has been a recent one that we had. Measles, we were lucky in Kentucky not to have that as much as Washington State did. We've had chickenpox, and we know that as you're planning your reopening, you almost need to make two plans. You need the plan for how you're going to try to prevent the infection from coming onto your campus. And then you need that second plan of when the case happens, and it's pretty inevitable you will have a case. Then how are you going to contribute to the contact tracing efforts by your local health department? And then how are you going to determine what part of your educational system is either closed down completely, which we would hope not, or can you cohort these students so you can do a more surgical intervention and try to only close down part of your school system? So everything I've just talked about is very simple, but it is extremely disruptive to the life that we've known. So until we have that vaccine or that treatment or that cure, we are going to have to continue to use these public health tools. And with those tools, you just can't lay them out there. You have to educate, you have to adapt, you have to be patient with people and extremely tolerant. Because when I answer a question and it's not the question people want, they either ask me again, or sometimes they ask Dr. Stack, who I work directly for. It's kind of like if mom doesn't answer the question the way you want it, you go to dad. But the answers to the questions about the virus, as we know it, are pretty stable. So the local health departments, who are the water bearers of all things public health at the local community level, as well as our department, are organizing ourselves in such a way to be as helpful as possible to the school systems. So this is a website that I use quite frequently. It's called DIVOC 91. And what that is COVID spelled backwards. And they do a nice job of displaying the data across the United States. So here you can see where Kentucky is. And this is all total confirmed cases over time from when we had our first case. And you can see that down here So where Kentucky had our first case, others had already started having cases. I think it's interesting because when you go on the website, if I put my cursor right here, it will tell me what state that is and how many cases it is for that particular day. If you look at Washington State, who had some of the first cases, look how they kind of disappear into the crowd down here, as opposed to this is New York right here, this top line. I think one of the biggest differences in why New York and Washington State crossed each other is Washington State had just had that big measles outbreak that I was talking about earlier. They had pulled out all of these public health tools to stop spread. Measles is incredibly easily infected. And so when they pulled those tools back out again, people went, oh yeah, social distancing. Oh yeah, wearing masks. Oh yeah, this was not new for them. When you look at the school system in Hong Kong, I read a really interesting article there and how they've had very little spread compared to such a densely populated area. They had SARS back in 2002. I'm sorry, I'm blanking on the date. So they knew how to institute all of these public health tools. It wasn't new. There wasn't a buy-in that had to be bought. People already knew what they were dealing with. So this gives you a little bit of an idea of where Kentucky is. This comes from our website. This is the dashboard on our kycovid19.ky.gov. I'll give you that later in this presentation. But if you go to the dashboard, it can show you the total number of cases, breaks it down by age group, deaths by age group, and then it does a pie chart for you. You can also click on here ethnicity and then sex, so you can break down the races, the cases by race, ethnicity, sex, or the deaths by race, ethnicity, and sex. This is a map that's true to all the public health directors on the call are very familiar with this, and this is our EPI curve, our epidemic curve, and it shows, and these are the specimen collection date of positive cases. So you see a rise, you see us going down. That was very exciting. We call this kind of our plateau area. But then the last 2 weeks have hit. Now that's not reflected here because all those cases haven't been reported yet. But we have seen in the last week a 48% increase in our cases. So if you look at this number right here, you're probably looking at 240. But we had this last week 300 plus cases on a couple of days, the most that we've ever had in Kentucky. If you hover on a county, it will show you the particulars on that county. I picked Taylor County, not picking on Campbellsville University, but that's where I was born, was Taylor County. So this tells you that Taylor County has had 52 cases. They've had 1 death, what their population is. So any of these counties you can click on. If you're looking for information for data, you can go there and see that. You can also click on the rate map, which shows that in Kentucky with 52 cases and this population, it will give you the rate, excuse me, for that county. So it's a very helpful piece of information for you to figure out where are we in the county where I live. This is going back to the 91 DIVOC website that I told you about, and I pulled these off yesterday. This shows you looking at New York State. These are their cases, and you can see how those numbers have gone down over time. Kentucky, you can see that we're way, way low on the numbers here on this slide. However, if you look at, so that here's New York, you can see New York here. You can see what's happening then in Arizona, and that has to do with reopening the state and reopening, people going out and doing more activity. They don't have what we had, a healthy at home recommendation, and you're seeing these numbers go up. Now, if you look here at Kentucky, and I'm having a hard time seeing because of there we go. If you look here, you see Kentucky pretty low, but if you look, you see that little bitty increase right there. Well, that's the last 2 weeks. So if you take this graph from the DIVOC, the 91 DIVOC website, and look over here, this is 1 million. Well, the reason Kentucky's not showing up very far is because Kentucky hasn't even had 500 cases in a day so far. So if you actually blow that screen up, then you can see where Kentucky, and this is showing that we held our own for a while here, but this is the last week, and you can see our cases going up over the days. So we have a lot ahead of us, and I know our local health departments are very aware of that, as we are at the State Department for Health. This is another thing that you probably heard people talk about, is positivity rate. And you can see that in Florida, they had a little bit of time where their positivity rate was low, but now what they're finding is that about 1 out of 5 people that they test are positive. So it's very important that we do more testing so we can find those people, get them isolated, and get their contacts quarantined. Kentucky was in a nice low place here, but again, if you think about it, end of May, middle of June, we started opening up more businesses, and we started seeing a higher positivity rate. This is not a current slide, but it does give you a good idea. The Gatton College of Business and Economics looked at all the modeling across the country and across the world, and came up with what they were looking at is the logarithmic scale of what they expected Kentucky's rates to do, and what they expect. This is looking at it on a linear curve. And you can see that Kentucky, because of all the hard work that all Kentuckians did, we definitely did not match that model. And what we don't want to do is, after we've worked so hard with the social distancing and what mask wearing people did and hand washing, we had such good outcomes. We want to make sure that we maintain that. This is another website if you're looking for individual data, and this is called covidexitstrategy.org, where they take different states and look at different factors. So what I did was I went in and I looked at not only Kentucky, but all of our border states. So regardless of where your university is around the state, if you're close to a border, it gives you some information. So this is your 14-day trend. Now, I said 48%. I was talking about the last week, but in the last 2 weeks, we've gone from a rolling average of 212 cases to 392. We're getting pretty close to our testing goal of 100%. This is the one that worries most of us at the State Department for Health, is this ICU occupied. That's been pretty low. That's beginning to go up. We're also seeing more requests from the state for remdesivir, which is a medication that will shorten your hospital stay by about 4 or 5 days, which doesn't sound like a lot unless you're that person in the ICU. 5-day shortening of your stay is pretty phenomenal. And then if we look at new cases per million in Kentucky, you can see that number compared to all our other states. Tennessee is particularly hard, and you can see that across the bar there. Another place that you can go to look for individual county level data is globalepidemics.org, and they have a red, yellow, orange, and green. And you can see Kentucky's right in here. So what I did was this was what their red, green stand for, and tell you. So if you've got the dark red, you're at stay-at-home orders are necessary. I blew that up so you can see where Kentucky is right in here. And again, I went in and just clicked on Franklin County because that's where I live now. So Franklin County has 4.2 new cases per 100,000 people, 7-day moving average. In the yellow category, we've had 159 cases and 4 deaths. So it's just another place that you can go if you're trying to get individual data about your county. This is the document I was talking about that we've been working with the Department for Public Health, and the Kentucky Department of Education. It is a safety expectations and best practices. So what we did was we took the things that we were talking about. We took social distancing, mask wearing, hygiene, transportation, and tried to give people what we felt like were the minimum safety levels that they needed to have in place to open a school. Then we added what we call best practices. You can do this, but these are some things other people are doing that we think would be better. It may not be something that you can manage in your school system, but this would be a goal that you might want to reach going forward with your team. So there's the COVID-19. Oh, I did it again. Shoot. Kentucky COVID-19.ky.gov. That is not the name of the website. That is my poor typing skills, and I missed that when I did it. So it's kycovid19.ky.gov, and that will get you to that website where you can find all of the Healthy at Work documents. You can find videos. You can find links to CDC documents. You can find information about contact tracing, and you can find that dashboard that I showed you a photograph of. I went through some of the questions that you sent in. Let me get that off the screen because of that typo is driving me crazy. These were kind of the general areas where the questions were posted. And Lee, if it's okay with you, do you want us to go ahead and address those questions now and then open up, or how would you like me to proceed?
Well, first of all, thanks, Dr. White. The information you provided has been, I think, is going to be tremendously important and very helpful. Why don't we just take the questions as they came, and I'll get you to respond. And we also have on the line Travis Powell, who is the General Counsel at CPE. And Travis, you may want to weigh in on some of these. We also have Greg Rush, a Senior Fellow at CPE, who has been our point person in working with your presidents on your campuses about reopening plans. So with that, let me start with the first question, Dr. White, and get you to respond to that. One person asks, I am looking for guidance regarding large-scale in-person events such as homecoming.
I wish we had that one later in the list, and I meant to move it on my slide and I forgot to, because that is that's $1 million question. If I could tell you, if your homecoming is in October, and I could tell you who we were going to be in October as far as what our numbers are, what our spread is, I could give you a semi-informed answer. At this point, I think we're going to have to say that we don't have a really good answer for this. It's hard for me to wrap my head. I mean, I've been working with KDE on what to do in a classroom of 15 students, to try to imagine what to do in a football arena, in a homecoming setting with homecoming parades and homecoming parties. That one is going to take a lot of work. And I don't know, I can tell you up front, it is not going to look like homecoming. It's not going to look like any homecoming you've ever had. I think that one thing that helped KDE a great deal, and Commissioner Brown, was he had a student task force, and according to him, they were pretty tough. They really did bring up some topics and some suggestions that he said he probably would not have considered doing. So I think the first thing people need to, as I said before, this is going to disrupt everything. Homecoming is not going to look like homecoming. How can you make it, though, something that will give the student body and the faculty some sense of community while making this completely different? I know that one community in Ohio, they had a Christmas party in this little town for 120 years. It was some long, long history. So what they did was they got the floats from last year and put them in the street or a big parking lot, I forget which. And people drove their cars around the floats instead of the floats driving down the street and people on, the sidewalk waving and yelling and shouting. Now, was that satisfactory? I'm sure it wasn't. But was it an event, and was it something people could look forward to? Yes, it was. We haven't talked any today about mental health, about providing some stability, some routine for these students, providing that camaraderie, not only among the students, but between the faculty and the students as well. So I think shooting for having some homecoming activities or any of the activities you've had before are a good idea, but you're going to have to get that student council with you, with your other advisors, and try to figure out how can we scale this in such a way that we are not increasing the risks of people spreading this illness because of all those asymptomatic cases that you're going to have.
Thank you, Dr. White. That is a tough area for campus leadership to be contemplating right now. And I know that time will tell on some of these issues. We had a question about masks, not surprisingly. If we are able to adhere to the social distancing requirements in both our office areas and classrooms, should students and employees wear masks the entire time they are on campus?
Very good question. Go back to the description about the videos. If I'm 6 feet away from you, then I should be protected from the viral particles coming out of your mouth. Personally, I have a mask on my desk. I'm at home today for other reasons. I've been going into work every day since the pandemic started. I have a mask on my desk. If I'm sitting at my desk like this, it lays on my desk. If I stand up, I put it on rather than walking around with it and putting it on and taking it off, putting it on and taking it off. I think that is going to cause me to contaminate my hands more because the outside of my mask could potentially have viral particles on it. My personal feeling is it's going to be much less laborious if people wear their mask all the time in public, unless they are sitting somewhere where they know they're 6 feet apart from anyone else that's in the room, and then drop that mask down. But other than that, because of the governor's new order for the next 30 days anyway, to see if we see a change in outbreaks, yes, I think that if you're in a public space, you need to be wearing your mask. If you're driving your car by yourself, no, you don't. But if you get out of that car and you begin immediately interacting with people, you need to have that mask on.
We had a question about work-based learning and internships. Someone from UK talked about UK Career Services is encouraging employers who offer internships and other applied learning experiences to consider shifting these opportunities to remote participation in order to reduce exposure and risk for students and the internship sites. So for employers who still intend to offer on-site internship opportunities, do you have advice for campus leaders and employers to help us reduce the risk factors for the coronavirus spread?
Well, I think it goes back to what I was saying about homecoming. There are people listening to this right now saying, well, if it's virtual, it's not an on-site internship, and they're not going to get what they have gotten in the past, and that's absolutely true. So your on-site internships are going to be very different. Will it involve some actual physically going to that site? I think in certain situations it will. And so that's when you make sure that if you've got your students are going somewhere in your name, it's under your guidance, that it's very clear to them that the guidance the expectations you have of them on campus reach when they go out off campus as well. And that's the hand hygiene, and that's the wearing of the mask, and that's trying to stay 6 feet apart if at all possible. So I think that's a responsibility on the university to be sure they understand that when they leave the campus, they are an extension of the campus, and they need to behave themselves accordingly, whether the people they are interacting with stay with those same standards or not. There is Connie University has a way we do things, and we expect all of our staff and faculty and students to behave in that manner when they're doing something official for the campus.
Another question about masks. If an individual, either a student or an employee or a faculty member, just cannot wear a face covering or mask, what advice are you giving both in the K-12 system and across the state on that issue?
Well, there are some medical conditions where masks are not, people with severe emphysema, COPD, even those 2 layers of cloth, because of their medical condition, makes it very difficult for them to be able to tolerate a mask. My advice for others is that if you have an asthma condition or you have some other medical condition, that you start wearing a mask in your home as practice. I think a lot of people think they're not going to be able to tolerate the mask. My father had sleep apnea, and the first time he put a mask on, he had a massive panic attack, and he was 85, and he'd never had a panic attack in his life. But he sat around the dining room table, and he put the mask to his face, and then he did it for a little bit longer. And so it's a gradual thing that people can learn to do. If you've got somebody who can't wear a mask for a very long period of time, at least they're wearing a mask as long as they can possibly tolerate it. We certainly don't want to trigger a medical event, but to say, oh, I have this particular diagnosis and I don't wear a mask, we may be triggering a medical event down the road for them. They are especially vulnerable to this virus, and they are especially the folks that would want to be protecting themselves from other people that could be infected. So I think the answer is you wear a mask as much as you can tolerate it. And there's an expectation that people will make their best effort at wearing it. And if they can't wear it for 3 hours at a time, at least maybe they wear it for an hour at a time. Anything they can do to mitigate spread and exposure to themselves.
So universities obviously are making detailed plans for reopening with faculty, staff, and student safety in mind. In your view, what is the likelihood that we will have to switch back to virtual operations before the end of the semester? And should we be planning for that as higher ed institutions?
Well, the word that I learned to use quite frequently working with the Kentucky Department of Education, looking at K through 12, was the word pivot. I think that with the uncertainty that we're looking at, I mean, we've seen our numbers increase, and we're just now beginning to see the 4th of July people, the people that took chances during the 4th of July and were in large gatherings and weren't wearing face coverings and weren't staying socially distanced. We're going to start potentially see our numbers go up. So I think you have to be going into this school year with the numbers that you have that day and the infectivity in your community you have that day. But you have to know that in 3 weeks, in a month, that all can change. And so having those plans in your back pocket so that you are not then in a scramble. You've got plan A, B, and C ready to roll. That's what's going to make your university and your college successful. It's going to bring student satisfaction. It's going to bring faculty satisfaction. None of us like uncertainty, and we are living in a hugely uncertain world right now. So the more different plans you have available and ready, so there's not a scramble, will make everyone's educational experience go that much smoother. So I would say that's a long way to say yes. I would have that plan because, and if you don't need it, well, then you've got a plan for the next time something happens. But right now, I think I would be planning for everything.
Let's talk a little bit about testing. We know that that's going to be an important part of the campus reopening plans. So what are your specific recommendations regarding student testing? And do you have any thoughts about actually paying for the testing?
Well, I think every university needs to decide who they want to test. There's not a universal recommendation from the department as to what every school in the state of Kentucky needs to do. I do know I've talked to a couple of universities that are planning on testing everybody when they come back. They're planning on testing all their faculty. I know that the governor at his press conference after we announced our Healthy at School, he said he wanted all public school teachers tested 10% every week. That's going to be a big lift. That's doable, but not without that planning we talked about. So starting right now to get in touch with laboratories, to get in touch with your local healthcare facilities and find out what's available in your community and how can you do this. I mean, you obviously, if you've got a campus with 11,000 students, you can't line all 11,000 of them up and have them all tested in one day. How would you do that? Would you do it by dormitories? There is not a right answer for this question because this is such a new condition. And I think as you share among each other and other ideas and look at what other universities have done is the best advice that I can give you. But in some parts of the state, there's a lot more testing available. Other parts, there's not, which is why getting that plan in place now, even calling a laboratory and say, we would like to contract with you to test our 11,000 students and our 4,000 faculty, and this is how we'd like to do it, and we'd like to set that up with you. The cost, we do know that it is covered by mandated to be covered by insurance. So if you have, if the faculty, and a lot of the students, since if they are from Kentucky and their parents have expanded Medicaid, they can be covered until they're 25. So that can be covered and that can be billed. The tough part is the uninsured. There are state paid for contracts that we have, but because you're going to have to hire someone to collect the specimen, it depends on if that lab already has the swabs and the viral media, the juice that it is transported in, whether they have that or not. There could be some expense. So they are allowed to charge for collecting the specimen and the expenses that go about with the equipment, and that varies depending on what kind of a contract you can get.
Thank you on that. There are a couple of questions just about sort of how higher ed in Kentucky can have a coordinated response on some of these issues. One question is, how can Kentucky Public Health and CPE coordinate effectively with Kentucky university leaders to determine statewide common criteria for sending students home and or transitioning courses to or from remote education?
Well, we'd be happy to be at the table to talk about that. You're talking about me getting into a swim lane that's not mine. I certainly don't have the criteria to determine when you do things and how you do things, but certainly can be available at the table to advise where the public health factors come in and what advice we might have for that. But and I wrote on my slide, someone had said something about what are the requirements for post-secondary education, and correct me if I'm wrong, but I don't think y'all have there's not a statewide thou must do this if you are post-secondary education. So I think if your group wants to do that, we're certainly we welcome the opportunity to be a part of that.
Well, thanks for that. And I might get our general counsel, Travis Powell, to weigh in a little bit on that, because as everybody on this call knows, Kentucky's institutions are governed autonomously by individual boards and have done a very effective job, I think, in developing campus plans. But I do think there's a role at the state level for some coordinated responses. And Travis or Greg, if you want to talk a little bit from your perspective about that, we'd love to have your input.
Sure. This is Travis, and can you guys see me?
Yes.
Okay. Dr. White, you're correct. I mean, there has been no order from the governor specifically related to higher education. And we've said this a few times in public settings, but also to our colleagues as we have these discussions, that higher ed was never closed. However, we have looked at guidance, the overall guidance from the governor on reopening just in general, and all the plans that we've seen from the institutions have considered those things, and I think are in compliance with that, even though it's not necessarily required. So we're seeing the things that you would expect through the individual plans. And right now, we are talking about issues broadly. The presidents have discussions about these things, but there has been no sort of coordinated response. And, we could certainly, pull some folks together. Each campus is different, obviously. And Dr. White mentioned, depending on the situation and where you are, and testing availability is different in different locations, and, in different regions may have increased cases, and that may require a different response. And obviously all our campuses have different space limitations and opportunities, so it would be different. But if there are certain things that we can all agree on, whether that be wearing masks in the classroom or that sort of thing, we can certainly pull together a coordinated response, and then let the individual campuses sort of tailor everything else that might change based on their circumstances. But if there are some big items, whether that be what to do when a person tests positive or that sort of thing, we'd certainly be happy to pull folks together and get a sort of a coordinated policy for all our campuses.
Yeah, and I've seen a lot written about one size fits all. There's not a one size fits all plan.
Right.
The thing that is consistent, though, is the virus. The virus is the same whether it's in Bell County or Benton, Kentucky, or wherever it is. And so you're right. There are those basic things that you could all agree on. One thing that I wasn't clear about is if you have a positive case in your on your campus, then your local health department will be your assistance in contact tracing and contacting that student and finding out who they've been with and around, whether that's a low risk because you passed them in the hallway, or is this someone you sat down and spent 45 minutes having a meal and nobody had a mask on because they were all eating? And how close together were you? Were you 6 feet apart? Were you sitting next to each other? All of those factors is what the contact tracer will do. And they will then know how to connect and contact all of those people that are high risk and need to be in a 14-day quarantine.
Well, thank you, Dr. White and Travis, for those responses. Let me invite the audience to submit additional questions via the chat function on YouTube. We haven't seen any as of yet, but we continue to have a couple that came in during the registration process. And a follow-up question, Dr. White, on the question of paying for testing. Let's see, do you know if insurance will pay for more than one test per person during a certain period of time?
Well, that question came up in a conference conference meeting I was in on Friday, and I don't know the answer to that, but we will find out about that. As a physician, I would say, well, of course they would, but I'm not an insurance person. So I don't know the answer to that. I'm going to write that down and I will get that answer back to you, Lee, so you can disseminate that.
Okay. Well, that covers the questions that we got through the registration process. Again, I invite folks to submit questions via the YouTube chat. We also are lucky to have on the Zoom call representatives from local health departments. And I don't know if anybody from out in the field would want to weigh in on some of these issues or provide some perspective. From CPE's perspective, we want to thank you for the work that you've done with all of the campuses. This is hard work, and your expertise and willingness to be at the table has been tremendously important as the campuses have been putting together these plans.
Well, I know that Dr. Humbaugh in Fayette County and I were talking this weekend about the off-campus activities as a community. And all you have to do is look at East Lansing, Michigan, where they opened a local bar. And they had last count I saw 127 cases from that bar. And I thought, well, they were so irresponsible. That's what happens when you judge. You know, my mama taught me not to do that. But I read an article about the owners, and they had spent their time off reading everything they could, buying plexiglass shields, had extra training for their staff, bought the staff all the PPE they needed. They had hand sanitizer everywhere. They had separated all the tables. They marked the sidewalk off at 6 feet. So as people were waiting to get in, they had done everything. But the woman said, we left out human behavior. Mm-hmm. And what happened was the first thing they noticed was people were pulling tables closer together. They went out on the sidewalk. Everybody was congregated. And they said, no, we've marked off the sidewalk. You have to stand 6 feet apart. And the people said, public sidewalk, you can't tell us what to do. They have so far 127 cases from that one bar of someone who was doing all the things the local health department had told them to do. So Dr. Humbaugh, I know you've got comments.
Yeah, thank you, Dr. White. Yes, there is certainly a concern about what students will be doing off campus once they return to the universities here in town in Lexington. And as Dr. White said, I'm not sure how much we can really control that behavior. I think maybe we can focus the behavior or inform students about what best practices are. On the other hand, this is also an issue for our secondary schools and primary schools when folks are going back, and then they're potentially going back to households where they're bringing disease and transmitting within the household. So they're going to school every day, potentially mixing with others, and then bringing it back out into the community, which certainly is a concern. So even I think universities need to think not only about their on-campus plans, but their off-campus plans, working with public health and with their local officials.
I know there's a lot of conversation about if you're going to have a party, if you're a fraternity, sorority, whatever organization, at least have it outside. Encourage them to have it outside. Talk to them about mask wearing. Encourage them to have masks that have ABCD or whatever their logo is, or red and black, or a purple and white. I'm a Kentucky Wesleyan graduate. A purple and white, a Panther mask. Anything to make it attractive, but to prevent the very thing we don't want, which is a party in an enclosed area with 100 people of their new best friends, and how that can spread. It's a real conundrum, and we haven't even talked at all on this whole call about faculty. The faculty are my age, which when I was in school I thought was ancient history. So if you've got a 66-year-old faculty member standing in front of a room full of students, they are at risk as well, or maybe they're not at risk, but their partner who has had cancer, or their child who is an insulin-dependent diabetic. This is a tough job that you all have as you're trying to weed through all of these different issues and make the best decision you can make. And then you move with that decision and set those expectations and stick with them.
Dr. White, another topic that hasn't been discussed much on this webinar is athletics. And that's particularly challenging because by their very nature, many sports are contact or very close contact. And so requirements for those, I think, are going to be potentially a little bit different. But still, there's the opportunity not only on the field, but off the field. And we want to try to be as safe as possible or minimize the risks as much as possible with student athletics.
Well, thank you for those comments. Another issue or area that you referenced in passing, but I think is tremendously important on a college campus, is the issue of mental health. I know there's a stress level that students will be coming onto campus with, faculty and employees the same way. And I don't know, in your conversations and work with KDE, if this issue has come up, and what are your thoughts, Dr. White, about how campus leaders might respond to this issue?
Well, I think what we have done with KDE is, again, made a set of expectations. There are things we can do to mitigate. If we wanted to completely eliminate the chance you would get this virus, then you would stay home with the doors closed. That's the only way you cannot get this. But once you step out of your home, you are placing yourself at a level of risk. So are you at a high level of risk when you're doing reckless behavior of not doing your social distancing and not wearing your mask? Are you going to be in a classroom setting, or if you're a staff member, a setting where you have a plexiglass screen, if that is doable for what work you're doing, making sure that you're at least 6 feet away from those students. If there are students up moving around in the classroom, everybody has a mask on so that any kind of viral particles aren't swirled around in the room, and the ventilation. We haven't even gotten into ventilation, and that's because that's one of my weakest links, and I'm going to be taking a course that we're going to be offering through EKU, who's doing a course for not only education, but also for local health department environmentalists, so that we can be sure that we're up to speed on ventilation issues. But I think it's what level of risk are you willing to take, not only as an employee of that school, but as an administrator, and you're making that plan. how can you minimize to the degree that you can, how can you minimize this risk of this virus? Because it is deadly. I didn't have a slide on deaths. We haven't seen an increase in deaths in Kentucky yet, but that's because it usually takes about 2 weeks after the illness. You start to see the increase in the illness before you start seeing increase in deaths. And we weren't seeing an increase in deaths in the country until just recently, within the last week. And we are starting to see that rate go up as well. And we're seeing, obviously, as you all know from listening to the news, more younger people having the illness, and then the tragedy of those 30-year-olds and 20-year-olds that are dying. And the 30-year-old in the ICU, the last thing he said to the nurse was, "I went to that COVID party because I didn't think this was real." Somebody had COVID-19 and everybody didn't think it was real, so they all went over to his apartment and had a party to see if anybody got sick, and this young man died. Mitigation's best. I mean, that's what you have to do, and you all know what those things are. It's just, how do you operationalize them in your setting?
Yes. Well, Dr. White, I don't see any other questions that have come up in the YouTube chat. One of the reasons that we wanted to have this webinar was to create some linkages between the campuses and your office. So I appreciate in advance your willingness to be a resource to our campus leaders. Dr. White has put her email up on the screen, and I know from my experience with her, she's open and willing to work with anybody who reaches out. We will continue these conversations at the CPE level and the department. And if need be, we'll have additional conversations like this with our campus leaders. So Dr. White, on behalf of CPE and on behalf of Kentucky Higher Education, thank you so much for your leadership and your participation. And we hope to do this again soon.
We have a pretty good public health village that's working on this across the state. And again, that is COVID-19, not COVID-10. They did not hire me for my typing skills. So please, we'll correct that before we send that out to anybody, please.
And thank you, everybody, for joining us, and have a great day.
Thank you.
Thank you.